Patients suffering from internal disc disruption related to a secondary disc-related disorder will frequently present with pain and flexion, a hypermobility at L4, L5, and a hypomobility at L3, L4. In that event, having discovered the hypomobility at L3, L4 through our joint-specific tests, we now want to mobilize L3, L4 so we reduce the amount of stress in L4, L5 each time the patient flexes. To do so, we will first begin with local traction to the L3, L4 segment, in this case on the right side. In order to do that, we first need to preposition the patient to lock the segments above the segment we're treating, as well as put the segments below the pain-producing L4-5 and the adjacent L5 S1 segment in a position where the mobilization will not create more pain, and to lock those segments. Well, let's remember that traction mobilization utilizes rotation. In this case, when we're treating the L3, L4 segment with traction mobilization, we're going to use right rotation. By rotating the patient to the right, we will be separating the right side zygapophyseal joint at L3, L4 in a direction that's perpendicular to the orientation of the zygapophyseal joint surfaces. So ultimately, we will be using right rotation for the mobilization. With that in mind, let's preposition the joint surfaces. First, L4, L5, L5, S1, the pain-producing segment, we will put that segment in those two segments in a position of extension because flexion is painful. Ultimately, we will be rotating all the segments to the right, this way. So with that in mind, we first want to put the L4-5 and L5-S1 segments while in extension, and ultimately in the rotating right direction, we will first side bend those segments to the right. The L3, L4 segments will be left in a neutral position, and with rotation to the right, will be allowed to side bend in the direction that they naturally course. The segments above the L3-4 segment where we're treating, we will be rotating them to the right, but because we're extending this segment, the segments above, we will use a direction of flexion to preposition. And after flexing those segments, before rotating to the right, we want to choose a direction of side bending that will lock those segments once we rotate them to the right. In order to lock those segments, we will side bend them to the left so that when flexed, side bend left and ultimately rotated to the right, the segments will lock.